Adam Aberdeen here to talk to you about the JSTIM Arthritis Treatment System. The JSTIM was developed specifically to treat osteoarthritis of the knee and rheumatoid arthritis of the hand. It's a combinational treatment system that combines proprietary electrotherapy, infrared heat, and compression. It's also a cumulative treatment system in that it is used at night while you're sleeping for about 7 hours and should be worn anywhere from 3 to 12 months for effective treatment results. Here are the components for your JSTIM treatment system for the knee. You have your JSTIM treatment device. You have a battery that powers your JSTIM treatment device, which is a lithium-ion battery that will need charge for at least 14 hours before use. A charging system for that battery. You have your lead wires that connect to your device. Do note, only one pair of lead wires is used per treatment knee system. And you have a second pair that you can use as a replacement, or if you happen to be using 2 JSTIM knee treatments on the body at once. You have your conductive spray that is used in conjunction with your conductive components. This is your red active square patch that goes directly over the knee. This is your black grounding pad that goes around your thigh. Both will need sprayed with conductive spray. This is your soft compression wrap that goes around the knee. Here is your JSTIM infrared heat components. This is your infrared heat controller. This is your infrared heat controller recharging system. And this is your infrared heat band. Do note, this side of your heat band emits the heat therapy and plugs in to your controller. Also included with your knee system components is a portable carrying case, and you have a black compression belt that can be used as it's sized right now and or trimmed down to attach your JSTIM components to your wrap. Once you have laid out the components of your JSTIM treatment system for the knee, I am now going to teach you how to assemble your knee system. First, you have your device, and you will need to insert your battery into your device. This is a lithium-ion battery and needs to be charged for at least 14 hours before use. Assemble it into the device in the back of the device. You can then turn your device on and set your treatment mode. Do note, there's 2 treatment modes present inside your JSTIM treatment device. The NT mode is your intended treatment modality, and it stands for nighttime, as the JSTIM is used typically during the nighttime for a 7-hour cycle to treat osteoarthritis of the knee. The other mode found in your device is simply a TENS device, and it's called the DT mode, which stands for daytime. That mode has been instilled into your JSTIM treatment device to treat symptomatic pain associated with your condition. So once again, it is the NT mode that you want to use on your afflicted knee. Once your settings are set, you can turn off your device and set it aside. Your conductive spray is used to spray your patches. As you can see on your black compression knee wrap, I have pre-assembled the black electrode, which is your ground pad, around the thigh area, and the red patch electrode around the knee area. You can see the running man is facing me as I'm setting it up upside down here. Also note, your pigtails are facing this way so that they can be threaded through the holes that are in your treatment wrap. To apply your infrared heat components, you will need to lift up your red active electrode for the knee, and you will need to take the side that emits the heat and face it outward, and then put your red conductive patch on top of it. Both wires can now be threaded through the holes of your wrap, and your wrap is now ready and complete to put onto the knee. Notice this is your thigh and this is your knee. All 3 straps will come around and close so that your knee wrap is complete and secure around the treatment knee. All wires will be coming out. Next, you will need to plug in your lead wires into your device. The black lead will go into the black cord coming out of your device, knee treatment system, and the red will go into the red plug coming out of your knee wrap. Be sure to put them in the right location, because do note, the color of your pad is not labeled on your pigtail. So you will make sure you're threading it through the proper hole so that you know which one is the black and which one is the red. So once your device is plugged in and your lead wires are now plugged into your patches, you are ready to turn on your device. Once your knee wrap is on, your conductive patches have been sprayed with 2 to 3 sprays, you can now turn on your device once all your lead wires and everything are plugged in. Your device should be set once again to NT mode. It'll run for a 7-hour cycle, and you should then in turn adjust your intensity up to a nice comfortable level. Make sure it is strong but not too strong. You may even be able to turn it all the way up to feel a very light stimulation. If that stimulation subsides, this is okay. The JSTIM is a very low-level stimulation due to the fact that it's used for 7 hours at night. Do note, your JSTIM heat therapy component controller can then be affixed to your wrap and plugged into the infrared heat cord, and it can be affixed to your wrap. To turn on your JSTIM heat component, you're going to hold down the red button. Once it's held down, you can then set it to low, medium, or high. Note, the JSTIM heating element will run for 60 minutes and then it will auto shut off. Also note, if you're not touching the red button, all lights will go off, and that's a power save mode. If you touch your red, you'll see your lights come back on. The 1 is your low and is good for about 4.5 hours of treatment. 2 is medium, 3.5, and 3 is high, which is about 2.5 hours of treatment. Do note, it is recommended to use your heat therapy components for only 1 hour in your 7-hour treatment cycle. Also included in your system is a black compression wrap. The compression wrap can be used now to fix your device to your knee system, and also, if need be, can affix your battery to your knee system. Once everything is connected, you will find your JSTIM knee system around the knee with your JSTIM device connected to it, as well as your battery connected to it as well. In summary, the JSTIM osteoarthritis knee system is specifically designed to treat your knee for OA or RA via proprietary electrotherapy, infrared heat therapy, and a compression belt that is soft, comfortable, and easy to sleep with. The JSTIM is a cumulative, long-term treatment system designed as a breakthrough arthritis treatment method.